Hello and welcome. You're watching NDTV. I'm Rishika Barwa. India has accounted for 50% of global cases and 30% of global deaths this week. The variant first found in India, the B1617, has emerged as a global cause of concern, the WHO calling it a variant of concern. More questions than answers at the moment on why India has increased the Covishield vaccine gap to 12 to 16 weeks, whereas the UK has just reduced it to 8 weeks in those above 50. To make sense of our fight against the COVID-19 pandemic, as always, Dr Randeep Guleria, the head of AIIMS, joins us. Thanks, Dr Guleria, for sparing your time and being with us. I want to begin by asking you the big question on everyone's mind at the moment. The UK has reduced the vaccine gap to 8 weeks in those above the age of 50. This coming in 48 hours after India increased it to 12 weeks. Is science driving this strategy or vaccine shortage?
So I think it's driven by both. It's driven by science to some extent and by the need for more and more people to get vaccinated as early as possible. If you look at what UK did when they had a huge surge in the number of cases in November, December, they increased the vaccination duration between the first and second shot by to up to 12 weeks. Now they're in a better position and therefore they have brought it down to 8 weeks. But the data itself suggests that even if you increase the vaccine duration between the first and second shot to 12 weeks, 2 or 3 things that we are concerned about are still met. One is the efficacy of people in terms of protection after the first shot. That efficacy is around 70 to 75%. Now, from a public health point of view, that seems to be all right. One could argue that from an individual point of view, you would like to have 80 or 90 or more than 90% efficacy from one shot to say that you're safe. But even if you are comfortable and you say that 70% or more of people are protected by just one shot, then that would be acceptable when you have a surging pandemic like we have in India. The second issue is that even after 12 weeks, do you get good immunity or do you get a better immunity? The data that has been shown suggests, this is based on the article in the Lancet, that if you were to get the vaccine in 4 weeks' time, the immunity that you get is only around 55 to 60%. This goes up to almost 81% if you get the second shot after 12 weeks. So it's based both on science and on public health issues in terms of trying to vaccinate more and more people now that we're seeing this surge in the number of cases as far as India is concerned.
But then what would explain the UK Prime Minister saying that they're actually reducing the dosing gap to 8 weeks because they fear the India variant or the B1617?
So in UK, the situation is very different from what it is as far as India is concerned. Their positivity rate is very low. The number of cases that they're seeing has really come down dramatically. As a matter of fact, their positivity rate is around 1%, if I'm not mistaken. So that is very different from the positivity rate that India is seeing. So each country and each region will have to develop its own strategy depending on how the pandemic is behaving in that area. It was behaving differently a few months ago in UK and in Europe, and they had multiple things in place, including the lockdown, including the vaccination gap being increased. But now things have changed there, and hopefully things will also change in India in the coming few weeks or months.
All right. So by your own admission, you're saying that it is science as well as vaccine shortage that is driving this decision at the moment. Correct. But what do people who took 2 doses at 4 weeks, what about those people? Are they now at a disadvantage? Because this includes our healthcare workers, our frontline workers.
So I don't think the data suggests that they're at a disadvantage. You see, as far as science is concerned, it's evolving, and especially as far as COVID-19 is concerned. Whatever data we had last year, some of it has become irrelevant. A lot of healthcare workers took hydroxychloroquine as a prophylactic treatment last year. Now we are not giving it because we say it doesn't work, and there's data to suggest it doesn't work. So as we come to know more and more things, we will change our strategy, and that strategy will also will vary not only as far as the vaccine is concerned, but as far as treatment is concerned, and when should we take a booster dose of the vaccine. So should it be that now those who have had the vaccine, say within 4 weeks, the 2 doses, should they get a booster dose earlier as compared to those who have taken it later on as we go along the pandemic in the later half of the year? That data will emerge in the coming months, and maybe that decision will occur subsequently.
Right. Well, speaking of vaccine gaps, now there is a big debate on when you should take the vaccine if you have been infected with COVID. The new guidelines in India say that you should, if you've been infected with COVID, you should take the vaccine 6 months after recovering. The World Health Organization said 4 to 6 weeks, and until recently it was 4 to 6 weeks in India as well.
Correct. So again, in an ideal situation, I would say after 4 to 6 weeks, one should get himself vaccinated, because we don't know how long your immunity will last, and it can vary from individual to individual. Again, this is based on two factors: vaccine availability and the fact that you do get some protection, and the chance of reinfection once you've had COVID is still very, very low. So you could look at it from another point of view, that if you have got COVID and you have antibodies in your blood, you are protected at least for some time. And if you delay your vaccination, you have two advantages. One is that vaccine would be available to others till we get more and more doses in the country. And secondly, if you delay your vaccination, then the shot that you get later on will give you an immunity which will last for a longer period in time.
Right.
So therefore, you may, if you get your vaccine later, then your immunity will be, let's say, 8 months from that point in time, as compared to if you got it earlier. So therefore, it may help you from that point in time. But like I said, this is an evolving strategy which depends on multiple factors: public health factors, availability, and of course, the issue of whether there is some degree of science behind it.
All right. Dr. Guleria, the other allied question is, what about people who get COVID after their first shot of the vaccine? How long after recovery should they get the second shot?
So this is again an issue which will evolve over a period of time. If you ask my personal opinion, I usually tell them that they should get the second shot after about 4 to 6 weeks. But there are data which suggest that if you've had the first shot, and if you get the infection subsequently, the infection also gives you a booster phenomenon, and your antibodies actually become much better. But since we don't have enough data, I still advise most of my patients to actually get it done after about 4 to 6 weeks to complete their whole course.
All right. That's important clarification, because I think a lot of people are, very confused after the new guidelines have come into place. But, after vaccines, I want to shift our focus now to the oxygen SOS that continues. There are over 70 people who've died in Goa because of shortage of medical oxygen. Once again, this is over 4 consecutive nights. The question that I want to ask you is, this surge in demand for medical oxygen, is it linked to the new variant, Dr. Guleria?
So there is a surge in demand for oxygen based on the number of cases that we're seeing. The variant has caused the surge in the cases to occur at a very short interval. If you look at the current curve, you'll see that it's almost vertical. That means in a very short duration of time, the number of cases has increased so much, and therefore hospitals have not had time to have a turnover. If this curve had risen to even 4 lakhs slowly, you would have a time for turnover. That means those who got admitted on day 1 could get discharged on day 7 or day 10, and then newer patients could be taken in. But if the curve is almost vertical, then you don't have that luxury, and that is creating this huge demand for oxygen. The second issue that I like to really say is that we must also understand that this pandemic is moving. It is moving from one area of our country to the other area. It seems to be moving now towards the east and the southern part of the country, and therefore our oxygen movement should also follow the pandemic. So in areas where now the cases have come down and they are comfortable, their oxygen demand their supply should actually come down in that manner, and it should be given to those areas where there's an increasing demand, so that as a nation we're able to really provide oxygen in a more holistic manner.
Interesting that you say that the pandemic is actually moving towards the east and the south. Why do you say that?
Because if you start looking at what's happening in states like Tamil Nadu or southern states, or if you start looking at data from the northeast or from Bengal, you start seeing that as compared to what is being reported in Delhi, that the cases have now started coming down, there is a rising trend in those areas. And the other concern, of course, is the movement of the pandemic from urban area to the rural area.
Yes. Okay, so these are of course states now that emerge as cause of concern. But coming back to the variant, the B1617 variant, which now according to the World Health Organization is also emerging as a variant of concern. The big question, Dr. Guleria, is will vaccines work? Many experts say that there will be a diminished efficacy. Do you agree?
Yes, so it's likely that there may be some degrees of diminished efficacy as far as the vaccines are concerned. There was a lot of concern with the AstraZeneca vaccine and the South African variant in some data which was published some time back. But we must also remember that, for most vaccines that we have a good amount of buffer. As a matter of fact, the WHO says that if your vaccine efficacy is 50%, then that is acceptable. Most vaccines that we have currently have an efficacy which is up to 70 to 90%. So even if we look at a vaccine which efficacy which comes down, let's say from 80% to 60 or 70%, it will still be effective. And the efficacy that we're currently looking at is preventing severe disease, preventing deaths, and to some extent preventing people from getting the infection.
So if I
think it will work. It will still be effective, but may have a reduced efficacy, and that is why over a period of time we will need to look at whether we need to tweak the vaccine to some extent.
No, so what you're trying to say is that the vaccines will work to the extent that they'll grant you protection from severe disease, but you could potentially then still get reinfected. So this
Right.
immune escape mechanism of this new strain, how soon can reinfection occur with the new strain?
So this is a question that we really need to look at, because we are seeing, let me put it in another manner. There was a time when we felt that many parts of our country had achieved close to herd immunity based on some sero-survey data which suggested that, say, even places in Delhi or in Maharashtra had a sero-survey suggesting that almost 50 to 60% of people were already having antibodies in them. Yet we saw a huge surge in the number of cases in that area. So the evidence indirectly does suggest that there is a chance of getting reinfection. You may have people who may have had mild COVID in the past, not a very good antibody response, and the variant may have caused reinfection in them, but we never were able to diagnose it as a reinfection because the first infection was not picked up, because we know there are almost 30 to 40% of people who have COVID infection are either asymptomatic,
right,
or have mild infection and never get tested. So because of that, it's difficult to really say how many people are getting reinfection. But in those who are definitely have been diagnosed to have COVID and who are hospitalized or took treatment, the chance of reinfection based on the current data seems to be low. But like I said, this is a pandemic which is changing. So this may change over the next few months, and we need to have very good genome sequencing data from the country to pick up emerging variants and being able to see how they are causing immune escape in terms of reinfection and in terms of the vaccine efficacy.
So if I can just understand this from a layperson's point of view, if you were, say, infected with COVID in the first wave, and now we are in a second wave and we're seeing a rapidly transmissible strain, you can potentially get a reinfection with the new strain irrespective of having antibodies.
So your antibodies will wane with time. So suppose you had got infected about 9 months ago and you had a very mild infection. We know that the antibodies will tend to wane and will tend to come down over a period of 8 to 9 months or over a year. And with the new variant, which is highly infectious in terms of spreading rapidly, you could still get the infection. And we do see that happening. The big question is, how frequent is it? And thereby, what is the chance of a larger number of people getting reinfection repeatedly over a period of time?
And we don't know at the moment how frequent it is. So we don't know how soon you can get reinfected. Dr. Guleria, the government says that cases are falling in about 20 states in the last few days, and we have seen a slight dip in the number of cases. The situation in the national capital, for instance, has improved. Maharashtra has improved. Can we say that India's past the peak of the second wave?
I think that's a tough question, but what I would like to say is different areas will peak at different times. If you say, can we say that Maharashtra or Delhi seem to have crossed the peak and are showing a downward trend? Likely, one would like to see that this is a sustainable trend over the next few days, and that the positivity rate comes to closer to 5%. If we are able to reach that, then one would say that these areas have crossed the peak. But like I just mentioned, that there are other areas which may still peak, and that includes the southern part and the eastern part. And once we are able to say that in these areas also the cases are starting coming down, could we say that as a country we have actually crossed our peak?
Right. The spread of COVID-19 infection to rural areas, how big a cause of concern is there, given the fact that diagnosis in these diagnostic centers in these areas are few and far between? How worried are you about COVID spreading to rural India?
So this is a big cause of concern, and we will have to develop different strategy or a different mechanism of managing patients of rural India. Firstly, like you said, testing may not be that simple, although we could really ramp up the rapid antigen testing, which is a point of care test, which will help. But I feel that we should also look at what we call a syndromic approach. You may not test everyone, but if he has the classical syndromic features to support a diagnosis of COVID-19, that person should be isolated, put in a COVID care center, and all this treatment strategy should be started. We must also have a proper protocols in place in terms of being able to triage people in the rural India, and those who are having more severe disease should be sent up to a district hospital or to a medical college. And one should use telemedicine, teleconsultation to help doctors in rural area managing these patients. We at the Institute are actually doing various webinars to really develop centers of excellence across the country, which can really reach out to doctors both in the private and the government sector in rural India, so that they have some sort of a training in terms of how to manage COVID-19, because it is going to be an issue in terms of management and diagnosis, and when we start talking of rural India.
Given the fact that diagnosis is difficult, there are also reports of deaths that are going undocumented. Are we actually underestimating our true numbers, given what we are seeing in rural India, given the extent of proliferation of the virus to rural India?
That is always a possibility, that we may be underestimating because of the fact that we're not testing in rural India. As like I said, we may have a syndromic approach, and that is something we will have to accept. One could also look at the trend of overall deaths. You may say that what was the trend in overall deaths that happened as compared to what the data was there, let's say in the pre-COVID time, and say that those overall, the rise that has happened could be because of COVID or COVID related. As far as the deaths are concerned. So you may not get a definite database, but you could get some rough idea as to what was the increase in number of deaths if you were to look at deaths overall, rather than saying that this is only COVID related, and try and see how much of this could be non-COVID, and then that would give you an idea. But relying only on the testing report will become difficult in rural India.
All right. I think that's also a huge cause of concern. We're going to slip into a very short break at this moment, but we'll talk about when states can begin to lift their lockdown amid this vaccine shortage on the other side. Stay with us. Welcome back. Dr. Guleria continues to be live with us. Dr. Guleria, the one question that's on everyone's mind is when can states actually begin to lift lockdown-like restrictions that have been put in place in several parts, given the fact that there is a shortage of vaccine supply?
So I think this is something that each region will have to decide on their own. But from my point of view, there are two factors that one would like to look at. One is the positivity rate in that area, and the second is the number of COVID beds that are available. If one finds that the positivity rate, and the current recommendation is that it should be less than 10%, I would be happy if it was closer to 5%, that if your positivity rate is close to 5% and you have at least at least 30 to 40% beds which are vacant for COVID patients, then I would say that one should consider lifting the lockdown to some extent. But if you have a positivity rate which is high, or 60 to 70% of your COVID beds are full, then it would be a little bit premature to lift the restrictions that you had, because then you may see a surge again, and then you'd have a problem as far as that is concerned. So, and along with that, I think the important thing is to keep sort of hammering in the message of COVID appropriate behavior, because this is the mistake that we made earlier this year, leading to the huge surge in the cases. Because we know that the variant which is now circulating is very, very infectious and spreads very rapidly.
But given this variant, Dr. Guleria, would it be prudent strategy to lift lockdown restrictions without vaccinating an adequate percentage of the population?
So in an ideal situation, one would like to have a large number of individuals vaccinated so that you know that there is protection in the community. But then that seems unlikely to happen in the very near future. The vaccine that we are having currently will continue to be in short supply at least till June or July, I think, till July, because in July we will have a large number of manufacturers now opening new plants and coming out with more and more doses. So till that time, it's going to be really difficult to say that we'll have enough vaccines to be able to vaccinate everyone like we'd like to. And even if we had enough doses, it will still be a sort of a staggered way that we could vaccinate everyone. Ideally, one should have a large number of population that is vaccinated before you can open up the restrictions that you have. But that luxury, I don't think we will have as far as India is concerned.
Well, absolutely. I think that's very important to note because it's the balance between lives and livelihoods at the end of the day. A lot of talk about the inevitability of a third wave of COVID, and also talk about the fact that, you know, children will be among the hardest hit. How are you looking a couple of months into the future?
So what we've learned from past experiences that the pandemic comes in waves, and there is likelihood that we may have another wave. Once this wave is down, we're still fighting the second wave. But once it comes down, I think we should not forget the learning from the first and the second wave. And if we sort of keep those learnings in mind, the third wave may not be that big, and I think we will not have a problem tackling the third wave because of multiple factors. One is the learnings that we've had. Secondly, hopefully by that time, we will be able to, would have vaccinated a large number of people. So there would be some degree of immunity in the population, which is there. As far as children are concerned, currently data does not suggest that there is a lot of differential as far as children is concerned. They are still less infectious getting less infection as compared to the older age group. However, the concern that is there is that unlike the older age group, children are not vaccinated, and they are a little bit of a protected population as of now because schools are all closed, and therefore they would be more susceptible to getting the infection subsequently if the infection starts spreading and we start opening up at that point in time. I'm confident that by that time we would have vaccine available for children also. Bharat Biotech has already started the trials for its vaccine for children between 2 to 18 years of age. Even in the US, many vaccines are now getting approval for children. So hopefully, we will also be able to start vaccinating children.
Any timeline for when the vaccine will be available for children in India?
So Bharat Biotech, I think by end of August or September, will be able to provide it to children. Their trials should be over by that time. There are trials going on for the other vaccines also. So hopefully, we will have vaccines in the second half of this year for children also.
All right. Well, I think we're going to end the broadcast on that good news. Thanks so much, Dr. Guleria, for being with us on NDTV and answering all our questions so very patiently. Thanks so much.
Thank you.